on Facebook, where you can just get the live broadcast right there, because it gets to stick there so that you can just go through and be updated on what's going on. Now, as I mentioned earlier, that I'll be having in studios esteemed experts from Texila American University Zambia. I will just be talking about World TB Day, which it's commemorated today on the 24th of March 2025. So with me joined here is Dr. Rajesh Amberpet, a medical microbiologist and assistant professor in the School of Medicine. Though I have introduced him, but he'll have to introduce himself. Doc, good morning.
Good morning, David. How are you?
I'm doing great. I'm actually happy that I'm having a doctor on set right now.
Yeah, it's my pleasure that on World TB Day, it's a good opportunity for me to being a medical microbiologist to convey about the World Tuberculosis Day, what is its importance, and how the common people should know about tuberculosis, and particularly about multi-drug resistant tuberculosis.
Well, thank you. Now, Doc, just in a general introduction, can you briefly tell us about your roles at Texila American University Zambia?
So yes, myself, I'm Dr. Rajesh Amberpet. I'm working as assistant professor of microbiology, and I did my PhD from one of the reputed institutions from India. In India, there are about 700 medical institutes, where I come from one of the top 5 institutes in India. And the quality of education over there, particularly medical, and it's very good. And I got an opportunity to do a PhD in one of the prestigious institute, and my area of expertise is antimicrobial resistance. Let me tell you, antimicrobial resistance is a big threat in the upcoming days. Neither HIV nor TB or anything, but particularly the antimicrobial resistance, because every day the resistance which is developed or acquired by the bacteria, multiple different bacteria, be it tuberculosis, be it Vibrio cholera, it's very high, and number of antibiotics which we are discovering is very low. So it's very important to understand about it, and that's my area of specialization.
And we're actually humbled to have you and to have an expert right here in the studios. Now, talking about World TB Day, maybe just to elaborate more, why is the World TB Day significant, and what message should the public take from it?
Yes, so let me tell you that World TB Day, which is celebrated to commemorate the discovery from Dr. Robert Koch, who is well-known scientist in the field of medicine, who discovered first the reason, the causative agent for tuberculosis is caused by a bacteria called Mycobacterium tuberculosis. He discovered that this is the bacteria which is causing TB. So it is an ancient age-old disease where the people will suffer from a lung infection, severe lung infection. It is mortality rate is very high, and they can transmit the infection to the respiratory droplets to the other persons. So in the remembrance of the Dr. Robert Koch on this day, who discovered the about this Mycobacterium tuberculosis. Yes, and a couple of things which I would like to tell you. That first thing to know, the tuberculosis, it's curable and it is preventable. Okay, it's very important note to remember about on World Tuberculosis Day.
Well, thank you, Doc. Now, we definitely do have, let me just say, is it types of tuberculosis, but maybe understanding for our viewers who may not be familiar, what exactly is a multi-drug resistant tuberculosis, and how does it differ from the regular TB?
Okay. So to understand about multi-drug resistant tuberculosis, first we should understand about tuberculosis. The tuberculosis is a respiratory infection. A person can transmit the infection through his respiratory droplets. The person who is suffering from tuberculosis, he'll be suffering severely lung infection. The lung will get damaged badly, and the person who cough continuously with the sputum, which is observed with the blood tinged, and continuous weight loss. So, and one more thing, the treatment for this is very, very tedious. It's not like you get a malaria, you get any other bacterial infection where few days of antibiotics is sufficient. But here in this case, I'm talking about the normal TB, not yet come to the MDR TB. Here, if a person acquires a normal TB, he has to take a treatment for 6 months. Every day, about 10 to 15 tablets of multiple combinations. Okay, if the weight of the person is more than 50 kgs, that he need to take every day. So this is about the normal TB. If come to the multi-drug resistance, there are set of antibiotics, first line, second line, third line. So if the first line, among the first line antibiotics, if it is not effective, when it's not working, that's That's where we term it as multi-drug resistant, and it is very, very dangerous.
So the name multi-drug resistant is coming from it not being responsive, or like it's not actually taking in the medicines, not like maybe responding to the medicine.
Sure. So if you want to know about the mechanism, so why the drug resistance happens, here the treatment duration is about 6 months. Okay, that means the patient has to take a medicine for complete 6 months. If a patient fails to take antibiotic regularly if he is not taking, if he is taking irregularly, then the antibiotic dose is not sufficient to eliminate the bacteria.